Hey folks, in Module 13, we're going to be covering the physical and cognitive development in middle adulthood. Middle adulthood, so says the text, starts around between 40 and 45 years old and ends between 60 and 65 years old. For Module 13, for your chapter reflection, I'm going to have you write a paragraph over each one of these four topics. The first one is physical development. Your second paragraph is cognitive development. Your third is careers, work, and leisure. And your fourth topic to write on is religion, spirituality, and the meaning of life. These will be listed on Canvas inside our module, so you will remember what to write on. But as we're going through here, just take note of those things, and it will make it easier for your chapter reflection. When we look at changing midlife and the nature of middle adulthood, we can see that as adults become older, their age identity is younger than their chronological age. So they actually identify a tad younger than they actually are. An increasing percentage of the population is made up of middle-aged adults and older adults. And so these people are gaining the population as there are more middle adult aged people. Again, middle adulthood starts between 40 and 45 years old, goes to 60 to 65 years old. They do have declining physical skills and increasing responsibilities. They have an awareness of the young-old polarity, and they're transmitting something meaningful to the next generation that is important to them, and reaching and maintaining career satisfaction is also something that they are focusing on. They have gains and losses, and biological and cultural factors balance each other between those two. And in late midlife, which is 55 to 65 years old, it's likely to be characterized by typically a death of a parent, the last child leaving their home, maybe becoming a grandparent, and preparing for actual retirement. When we are looking at the physical development of middle adulthood, we can see some physical changes. We can see visible signs, including skin wrinkles and sags, age spots appear, hair thins and grays, nails thicken and become more brittle, and teeth can yellow. Their height and weight, typically individuals will lose height and gain weight, and being overweight is a critical health problem for folks this age. When you're looking at strength, joints, and bones, a lot of times there is age-related loss of muscle mass and strength, and the cushions for the bone movement become less efficient, which leads to joint stiffness and more difficulty in movement, and there really is progressive bone loss during this age range. When we're looking at vision and hearing, there's an accommodation of the eye, and that's the ability to focus and maintain an image on the retina. It experiences sharp declines between ages 40 and 59 years old. This age group has difficulty viewing close objects, and hearing can start to decline by age 40, and specifically high-pitched sounds are typically lost first. When we look at the cardiovascular system of this age group, we see high blood pressure, high cholesterol, and cardiovascular disease can be very impactful for these middle adult aged people. This is linked to weight gain between the ages of 45 and 60. It's also linked to unhealthy diet in adolescence and lower SES. Exercise, weight control, and a diet rich in fruits and vegetables and whole grains can help with all of those things that are mentioned. Looking at the lungs, lung tissue becomes less elastic at approximately age 55, and it decreases the lung capacity of those folks. There's increased cardiorespiratory fitness during early adulthood, which is linked to better lung health over time, and sleep needed for optimal performance, but there are wakeful periods that become more frequent in the 40s. Sleep disordered breathing and restless leg syndrome increases in the 40s, and there are less effective immune system functioning linked to less sleep. So we need sleep for optimal performance, but all of these things are happening to these folks in their 40s. When we are looking at some chronic disorders, it is rare in early adulthood, but can increase in middle age. Stress and disease, we can see there that the immune system and the cardiovascular system are both affected by stress and disease. And then we can see that control peaks in midlife, then declines in late adulthood. Looking at mortality rates, we can see that chronic diseases are the main cause of death during middle adulthood, and the two biggest factors there are heart disease and cancer. When we look at the sexuality of this age range, we can see that midlife transition in which fertility declines. There is also menopause that will show up during this time, typically late 40s and early 50s, and that may cause hot flashes, nausea, fatigue, and rapid heartbeat. And then there is something called perimenopause, which is the transitional period from normal menstrual periods to no menstrual periods at all. One of the things that happen at this age bracket can be hormone replacement therapy. It can happen for treatment for unpleasant side effects of menopause. But it augments the declining levels of reproductive hormone production by the ovaries. It consists of various forms of estrogen, usually in the combination with progestin, but we can see that the HRT linked to increased breast cancer risk, which is something to note. Hormonal changes in middle-aged men, they have a decline in sexual hormone level and activity. Looking more at sexual attitudes and behavior, sexual activity occurs less frequently at this age range. Men are more interested in it than middle-aged women. And if you are living with a spouse or a partner, it does make the difference in terms of engaging in sexual activity. And frequency is linked to increased cognitive functioning. When we are looking at the intelligence of this age bracket, we can see kind of two different intelligences that the text talks about. Crystallized intelligence, and that is the accumulated information and verbal skills. This continues to increase in middle adulthood. We also see fluid intelligence, and that's the ability to reason abstractly, and this may begin to decline in middle adulthood. When we're looking at information processing, it's the speed of information that you can take in. It can include reaction time, but this can be declining, and the reason for that could be levels of analysis, cognitive, neuroanatomical, and then neurochemical as well. When we look at memory of this age bracket, verbal memory declines during middle adulthood, and there are linked to changes in working memory and ineffective memory strategies. Looking at expertise, they rely on accumulated experience. They process information automatically and analyze it more efficiently. They have better strategies and shortcuts to solving problems, and this age bracket are more creative and flexible in solving problems. Practical problem solving is everyday problem solving, important aspect of cognition. It improves between early adulthood to middle adulthood, and it does begin to decrease at about 50 years of age. When we look at the work in midlife, the role of work is central during this middle age bracket. In the US, about 80% of the people between 40 and 59 years of age are employed, and it's really a time of evaluation, assessment, and reflection about their work. we can see that when they reflect on careers, challenges, and changes, some challenges of working at this age, the globalization of work, rapid developments in information and technology that they might not be prepared for. Downsizing organizations can be difficult if they are some of the people that may get cut. Early retirement, pensions and healthcare, and some changes that might happen to them is self-motivation and then consequence of losing one's job. Both those things can be big changes in this age bracket's life. Um, Opposite of work, or it can be opposite of work, is that leisure time or the pleasant times after work when individuals are free to pursue activities and interests of their own choosing. Leisure pursuits link to better cognitive functioning and longer life, so it's important to get out and have fun. Changes may expand opportunities for leisure, so that is something important to think about. When we look at religion, spirituality, and meaning in life, two different words there. Religion is organized set of beliefs, practices, and rituals, and religiousness is the degree to which an individual is affiliated with an organized religion. And when we're looking at that, religion is positively linked to health, and religious commitment helps to moderate blood pressure and hypertension. When we look at the meaning in life, it's emphasized each person's uniqueness and the finiteness of life. According to Frankl, the three most distinct human qualities are spirituality, freedom, and responsibility. And we can see here that according to Roy Baumeister and Kathleen Voss, the four main needs in someone's life at this age are need for purpose, values, sense of efficacy, and self-worth. Again, you are going to write 4 paragraphs on physical development, cognitive development, careers, work, and leisure, and then religion, spirituality, and meaning in life. If you have any questions, please let me know. Just reach out to me through email, and I will quickly respond. I look forward to reading your chapter reflections.